Hello, in this video I will be talking about the chemo regimen we often call AC in the treatment of breast cancer. Before I go on, I want to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. If you're curious about whether AC might be part of your treatment plan, I'd love to invite you to go to Yerbba.com to get your personalized Yerbba report. Your Yerbba report takes your medical record information after you give us permission and then cross-references that information with the most recent medical updates in terms of breast cancer treatment, and then generates a report for you that is personalized just for you with your treatment options and the pros and cons of each. All right, so what is AC chemotherapy? If you've already had AC chemotherapy, you are pretty familiar with this regimen. If you haven't heard of it, it's made of two different drugs, A and C. The brand name for the A is Adriamycin. The scientific name is Doxorubicin. The C stands for Cytoxin, the brand name, or Cyclophosphamide, the medical or scientific name. These medications have been used for many, many years, for decades in fact, to treat people who've had breast cancer, particularly breast cancer surgery, or who will be going to surgery, and this chemotherapy is given to reduce the risk of the cancer coming back. When it's given before surgery, it's called neoadjuvant therapy, and when it's given after surgery, it's called adjuvant therapy. These two drugs together, one is given by a very large IV push, that's the Adriamycin, and one is given through a small bag of fluid that runs into a vein. These two medications together are highly effective in killing cancer cells. Doxorubicin and cyclophosphamide work different ways, and when they're given together, they actually have synergistic effects. They have new effects that aren't there with each of the drugs given alone. Doxorubicin and cyclophosphamide, or AC, are usually given for 4 cycles. They're commonly used in people who have a lower risk tumor. So perhaps a stage 1 tumor where chemotherapy is not required to be as lengthy or as aggressive. So a small tumor with negative lymph nodes or somebody with 1 lymph node might be given Adriamycin and cyclophosphamide, AC. Beginning in 2005, the combination of AC followed by paclitaxel, or given concurrently with docetaxel, called TAC, these two regimens were shown to be superior over AC alone in people at higher risk of recurrence, so people with positive nodes or a particularly active tumor by virtue of grade, for example. So AC followed by paclitaxel, or given concurrently with docetaxel, is used commonly in people with stage 2 breast cancer or stage 3 breast cancer. In general, AC is given every 2 weeks or every 3 weeks. When it's given every 2 weeks, people need to get shots of a growth factor medication. We'll have a link to our growth factor video as well here. And it's usually given for 4 treatments or cycles. And each cycle is, as I said, every 2 or 3 weeks, for a total of 4 or maybe 6. In general, we try to avoid giving less. In general, we'd rather give 4 cycles than more because of the cumulative and long-term side effects of this chemo regimen. 4 is the most common number, and then often followed by paclitaxel as well. I hope this video has been helpful. Have you had AC? Drop a comment or a question below. Let us know what your experience was with treatment. We try to get back to you within 1 to 2 weeks. Thank you, as always, for watching.